Telehealth nursing has expanded rapidly, but many nurses still see it as secondary to in-person care. There is a common belief that virtual care is limited, less serious, or easier. In reality, telehealth requires strong assessment skills, clear communication, and careful attention to legal and ethical responsibilities. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Telehealth nursing exists to increase access to care while maintaining safety and quality. It does not replace bedside nursing. It extends nursing judgment beyond physical walls. Nurses must rely more heavily on observation, questioning, and clinical reasoning when hands-on assessment is not possible. Think of telehealth like navigating with limited visibility. You cannot touch or examine the patient directly, so every visual cue, word choice, and response becomes more important. Nurses learn to gather accurate information through focused assessment and attentive listening. In practice, telehealth nurses assess symptoms, monitor chronic conditions, provide education, and determine when in-person care is necessary. Changes in voice, breathing, appearance, or mental clarity can indicate deterioration. Nurses must recognize these signs without relying on physical examination. Legal and ethical considerations are central to telehealth practice. Nurses must practice within their scope, follow licensure regulations, and protect patient privacy. Documentation must be clear and accurate, as virtual encounters rely heavily on written records. Informed consent and secure communication platforms are essential to maintaining trust and safety. Across healthcare systems, telehealth supports continuity of care, particularly for patients with limited mobility, chronic illness, or geographic barriers. Nurses play a key role in triage, follow-up, and patient education, ensuring that virtual care remains effective and safe. The NCLEX reflects these responsibilities by testing professional accountability, patient safety, and ethical practice. While telehealth may not always be named directly, scenarios often involve communication, documentation, and appropriate escalation of care, all core elements of virtual nursing. In real nursing practice, telehealth requires confidence and boundaries. Nurses must know when virtual care is appropriate and when it is not. Recognizing limitations and escalating concerns protects patients and supports safe outcomes. Telehealth nursing also highlights the importance of clear communication. Nurses guide patients through self-assessment, clarify instructions, and ensure understanding without physical cues. This skill strengthens nursing practice in all settings, not just virtual ones. Now that you understand how telehealth nursing operates within clinical and legal frameworks, the next step is exploring how smart devices and connected systems support nursing care at scale. That leads directly into understanding medical devices and the role of technology in patient monitoring. And that's exactly where we'll go next here at the Learning Studio.